Hi everyone, we are here with Jennifer McGowan. She is a doctor of physical therapy, and I'm going to have her introduce herself to you guys and talk about what she does.
I am, again, a doctor of physical therapy, and I got my degree 13 years ago, and I was primarily an orthopedic physical therapist. For those of you who don't know what physical therapy is, we focus on the movement of the body, watching functional movement, see how the spine moves, how the muscles work. And so I became a pelvic physical therapist 4 years ago after I had my twins. And I had some personal things happen, like having a prolapse and diastasis with my abdominal muscles. And now I primarily just see moms of all ages. And I also see women before they conceive babies as well. I opened my practice 2 years ago.
Awesome.
So, yeah.
So I really wanted to talk to you today because what you do for women as far as postpartum care is very important, and I don't think that many women and moms know about pelvic floor therapy and the importance of pelvic floor therapy. So can you tell us why pelvic floor therapy is so important?
Of course. So we have our little model here, and this is, of course, not a pregnant pelvis, but we do know the uterus grows, I don't know how many sizes larger. Do you have that? I don't know. But it grows a lot larger than this little uterus. And you'll see, I will take the organs out and set them aside. Pelvic floor muscles really have to elongate and lengthen, and as well as the abdominal muscles. And so baby either comes out vaginally and we can have tearing through the muscles, or a C-section. Either way, baby has to come out. Muscles can be lengthened, muscles can be weakened, and muscles can tear. And so if you think about anything else in the body, like if I tear a hamstring or if I tear my rotator cuff muscles, I get rehab for that. But for some reason, we think we can tear here in just 2 weeks, go back to normal, and not even have to have any kind of rehab process to our pelvic floor. So really, after mom gives birth, we need to make sure that these muscles are functioning for us, because it's the bottom portion of our core. And this is really, I like to describe it like the foundation of a house. Like, this is our foundation. And if we did have a tear and we have things like painful intercourse or the bulge, like the prolapse that we hear of, we're trying to build a foundation, or our house, on a foundation that's weak and maybe not as optimally functioning the way we need it to. So pelvic floor physical therapy, we're really looking at building that foundation. So when we talk about the foundation or the pelvis, we want to first of all restore motion and posture after giving birth, as well as making sure these muscles not only are strong, because everyone wants to make sure they can do like a strong Kegel, but we also want to know, can they lengthen and relax so that you can have a nice bowel movement or empty your bladder and have pain-free intercourse. So it's important to build the foundation of the pelvic floor, particularly the muscles, because we want to know that they can function well with lengthening so that you can have a good bowel movement, so that you can have pain-free intercourse and empty your bladder. We also want to know they can contract and support your organs. And then timing. So a lot of people leak when they cough, laugh, sneeze, jump, or run, because they're gripping a lot through their abdomen, and they're not engaging their pelvic floor muscles the way they need to be. So, I mean, the foundation, we want the function of the muscles to be doing what they need to do, as well as getting your pelvis in a better posture, because again, it had to expand to let baby out. Sometimes women can get really stiff in the pelvis and hips. Pelvis, hips, and lumbar spine after giving birth, and I see women like 20 years down the road, and they're still stuck in like a pregnant body with that posterior tilt. So
talk to us about some common signs and symptoms women can have that would prompt pelvic floor therapy.
So the common ones that usually probably come to both of us is going to be, by far, probably would say postpartum is going to be painful intercourse. And so a lot of women feel that it's really a silent subject that a lot of women struggle with. You don't have to have painful intercourse prior to having baby to have it afterwards. There's really no pattern, but that's probably one of the most common signs that come up. And women will struggle with this for 10, 20 years and come and see me. And so I would say, painful intercourse, that's something that's really common. Also, leaking urine. So leaking urine when I stand up, leaking urine when I cough, sneeze, lift my baby, but primarily the women that try to get back into fitness. So they're trying to get back into running or HIIT training, and then they're peeing, and then they just quit, and then they just become sedentary, which is almost worse for the body. So, and then the other common one is going to be, there's several, but prolapse. And so a lot of people don't know what prolapse is, but prolapse is essentially where you're going to see a bulge of tissue. You probably hear bulge either coming out right behind the urethra or at the bottom of the introitus here. There's about 4 different types of prolapses. Sometimes the cervix shows, and so people have that bulge, and it's not pathological. It's just really, really annoying and obnoxious.
Yes.
So, and we definitely want to catch that early to treat it.
Yes, a lot of moms sometimes will call and text me or say, I took a mirror down there and I saw something coming out. So that's a common complaint that I'll get from mommies who probably could benefit from.
Yep. Yeah, so that's another thing about that too is right after baby, there's a lot of healing, there's a lot of blood flow that's in that area, and swelling even. So 6 weeks postpartum, when you may see your midwife or OBGYN, they will of course usually check for prolapse, but it still could reduce on its own within about 2 to 3 weeks. You're gonna have to talk to your provider, whoever screens you. So the prolapse can be several different stages, and your OBGYN, midwife, they can screen that for you. I definitely would say you would want to see a pelvic physical therapist to see how you can reduce those symptoms as quickly as possible. Again, they could go away and reduce on their own, but sometimes they don't. And the quicker we get to them, the better physical therapy works, because if it's a moderate prolapse and it's really sticking outside of the vaginal opening, there's not a whole lot pelvic physical therapy can do at that point, but the earlier we catch it, the better. And so I would say a lot of women can be asymptomatic with their prolapse.
Yes.
So if you're going to your postpartum visit, I would definitely always say, can you please screen me for a prolapse, so that you know, because a lot of women won't have signs and symptoms of a prolapse. If it's like a mild one, you'll get the ones that say that it bulges since you're being a midwife, but I know a lot of women that can have a grade 1, a minimal one, and have no symptoms at all. But the symptoms of a prolapse are not just going to be the bulge, but sometimes heaviness, like there's a tampon in your vaginal canal, or fullness, or tired, and then low back pain.
Okay. So can you talk to us a little bit about diastasis recti? Did I say it right?
Yeah.
DR, for sure.
It's diastasis or diastasis, DR.
I never get the word right.
It's a little complicated because there's so much information about this can correct it in one day. I've got this program and that program. So I would say diastasis is that separation of the abdominal muscles. It's between basically your 6-pack muscles. And so do you screen for that?
Yes.
So you're going to see changes. You will have improvement of your diastasis by 8 weeks postpartum. It's going to stay where it's going to stay if you do nothing at all. So diastasis is really just that connective tissue's been stretched. And I say deformed, even though that's a bad word, it's just the best way to say it. We don't know why some people get it and some don't. So regardless of the information out there, but the problem with that is you can get the mom tummy. Many people don't like the bulging there. But you can also start getting back pain, hip pain, increased risk for leaking and prolapse. And so essentially to heal that, you need to not only look at the width, so how many fingers you can put in between, but the depth. That's even more important. And so we want to look at the depth of it. And again, like prolapse, you can have mild, moderate, and severe diastasis. A mild one's probably going to go away on its own. But anything that's greater than 2 to 3 fingers, but you can press really deep into and almost touch your spine, that's probably more of dysfunction, that your deep transverse abdominis muscle, which is a corset muscle, isn't engaging and doing a good job to help support your spine.
So this is not a condition that you can just do some crunches and fix it.
No.
The crunches and sit-ups are the last thing you want to do, I hear.
Yeah, so I have diastasis, and I had a twin pregnancy, my 3rd pregnancy, and it's moderate to severe. And I'm 4 years postpartum now, and I'm still working on strengthening my abdominal wall. But like most moms, in between kids, I'm a physical therapist, but I didn't do the proper strengthening of my abdominal wall probably before. The strengthening of the abdominal wall can help prevent it, but we don't really have great evidence to even say that. That's kind of anecdotal. But
So what can moms do prenatally to prevent any type of prolapse, or do you recommend, is there any benefit to coming to physical therapy during pregnancy, or what do you think?
So the new standard a lot of pelvic physiotherapists want to see is being screened prior to conceiving. That way we can already assess your abdominal wall to see, are you at a greater risk of diastasis, which I've done on my 3 daughters already. And then you want to get your pelvic floor muscles assessed because you want to see what is the strength, can you lengthen them, just to know your foundation. But I think we're far away from screening people before conceiving.
Yes.
So a lot of midwives and a few OBGYNs will send clients to me when they're pregnant if they're having symptoms of prolapse. And so what we want to know during pregnancy is the same things as if postpartum, and that's, can you engage pelvic floor muscles? How long can you hold it? What's the power behind that contraction? Can you lengthen? Because birthing, as you know, is not, can I power out a baby? It's, can I lengthen and relax and get my pelvic floor muscles out of the way? So I think a lot of it's just education is empowerment to know what our foundation is. So pregnancy, I do have clients come into me, especially ones that are fit and active and want to know how to work out safely. And then I have a lot of moms that it's like their 4th or 5th pregnancy and they're dealing with prolapse and they want to see how to recover as quickly as they can postpartum.
Got it. Awesome. So where can people find you?
So I'm on social media, of course. It's Regenerate Physiotherapy is my Instagram account and my business page. And then I'm just launching a YouTube channel. It's called Peachy Mama Wellness. And what that's going to be is weekly videos on safe workouts for prolapse, diastasis, and then a lot of educational videos on things we were talking about, going more in depth of types of prolapse. And then I'm also going to be launching an online course in September for moms to recover after birth. So
awesome.
Yeah.
Yay. Well, thank you for chatting with us today.
You're welcome. It's so great to be with you.
Yay. Well, thank you. That's a wrap.
Really? Okay.
It is.
I'm like, boy, I could talk forever.
I know. I'm the same.